What is the difference between a nurse and a certified nursing assistant? What is the difference between their duties? Why is there a difference? Is there a difference? Plenty. Come back, let's talk about it. Hello and welcome to Nurse Amy TV. I am a CNA instructor, I'm a registered nurse, and I do everything CNA on this channel. I also do lifestyle and inspirational and motivational videos. So the topic for today, and I do get this also from my student, is what is the difference between a nurse and a CNA? Okay, plenty, a lot. Where do I start from? Number one, the amount of schooling you are going to do. Yes. So CNA and CNA, when I talk about CNA, I mean certified nursing assistant, nursing aide, okay? While a nurse is either an LPN/LVN or a registered nurse, okay? So, but let's just group nurse now and the CNA, okay? One thing I know, a student had asked me, actually, Tonya, how are you? And she's like, what is this? What's the difference? What's the big difference? Okay. And I'm going to answer you. Schooling. The CNA spends anywhere from 2 weeks to maybe a year, but that's even rare. A year to be a certified nursing assistant. So the amount of time you spend in school. The certified nursing assistant also doesn't do skilled care. Now you might ask, what do you mean she doesn't do, or he doesn't do skilled care? Because they are skilled, right? When you go through a school, you become skilled at your job, okay? You become skilled by learning about the job. CNAs learn about transfer, about feeding, basically ADLs, activities of daily living, everything you do every day. That is what CNAs help their patients with. And in some places, maybe more. Depends on the facility you work for, okay? So that is what they do. So, however, in the nursing or in the healthcare field, their duties are not seen as skilled. They're not termed skilled, but you need to be skilled at what you do. Does that make sense? So a CNA does basic care, basic direct care, things that everyday duties, everyday job, for want of a better word, maybe not job, but duties, or things that a patient needs to be doing, like feeding, like getting dressed, like making a call, okay? Like transferring from the chair to the wheelchair to the bed, things like that. Like actually toileting. You go to the toilet, you have a bowel movement, and sometimes they cannot wipe themselves. Not because they're being mean. It's just that the patient has been compromised, either cognitively or is actually even more physical, mechanical. Okay? That's what a nursing aide does. A nurse can do that plus more. So let's start with schooling. A nurse spends anywhere from, if it's an accelerated program, a year to 2 years to just be an associate, okay, and then 4 years to have a degree. So again, it's in the amount of schooling and what you get out of it. 2 weeks to a year, you're not getting a degree, okay? So nurses have more schooling. Why? Because they do more. They do what is termed invasive. So that means you all know what invasive means. If you don't, look it up, okay? But invasive means that, well, I'm going to tell you. They are the ones who would insert things into the body. So we're going beyond just the surface of the body now, and we're going inside. So nurses give shots, injections. Nurses will do IV therapy. They're the ones who will hook up an IV, okay? Intravenous therapy. Nurses also, we check blood sugar. Now, in some instances or some facilities, they actually let aides do that, but it's not really an aide's job. So nurses do check for blood sugar. Nurses also will be the ones to, they do treatments. Now, when I talk about treatments, there are different types of treatments. There is the breathing treatment, people who can breathe or their airway is clogged, and the nurses go there because they have the order from the doctor and there are different apparatus they can use to clear the airway. They can also suction, either by, again, physically or mechanically taking out the phlegm, or they soften it by different doses of medication. Again, that's all that nurses do. Nurses go inside the body. It's not just topical. Does that make sense? So I'm trying to, again, tell you the difference between a certified nursing assistant and a nurse. The nurse also does dressing, which I've talked about, a part of dressing. The other one is wound treatments, because again, on the floor, when you're working, we call it dressing. Have you done the dressing? Have you done the dressing? So dressing, wound treatments, okay? Someone has, skin tear, they have an injury, a pressure injury, they have gone through some kind of surgery, and this wound or this cut, it could be, a surgery could be a wound. It could also be a deliberate cut has been made there. It's draining fluid. Okay, so a nurse doesn't only just do all that. A nurse makes the assessments. Aides don't make assessments. Nurses make assessments. Nurses make assessments. What do I mean by that? Well, for one thing, when something is going wrong, say for instance you have a patient who has altered mental status. Okay, let me talk in layman's style. They, for some reason, they're not acting right. Okay, they're confused or they're being combative, because there are a lot of things that gives such symptoms. That is when an aide, you as the aide, if it's an aide, you go tell the nurse, and then the nurse then comes and make the assessment and investigate. That's what the assessment is. What is going on? Has there been any changes? Is it the medication? Is it because someone, they got a call and so it's affecting them in a certain way? Is it that they're impacted? There's so many reasons. They look at their chart, they look at their chart of care, and they're like, oh, well, okay, it might be, they check the vitals, it might be that this person's blood pressure is too high, or the blood sugar is too low, or it's too high, a myriad of things. That is what the nurse will then make that assessment and determine that, okay, we are going to have to get in touch with the doctor so we can have some kind of care in place. This is what a nurse does. A CNA, a nursing assistant, or a nursing aide doesn't do this. Again, the nursing aide does things that are just surface level. Again, I'm trying to explain it without using too many different terminologies that will throw people off. So, nurses and aides always butt heads. It's interesting, but it's not surprising to me. I'm actually writing a book about the bullying culture of in the nursing field, and it just trickles down to nurses and the nursing department, because it starts way up even before we get to the nurses. By and large, the history of nursing and medicine and what have you, healthcare, it's very hierarchical. Does that make sense? It's all about hierarchy and status. So you find that those that are placed, maybe their offers, tend to dump on the ones beneath them. Anyway, we'll talk about that later. For those of you who know me, I have background in filmmaking and writing and what have you. A lot of my students know that. But I've been doing a research on nursing and healthcare, and why is there this bullying culture, So anyway, so that's one of the things I came across. So nurses and aides will always butt heads, and you always have good aides and bad aides. But a lot of aides think that nurses don't do any work, and all they do is pretend to stare at the computer. They will not answer call lights. They will not change patients. They will not transfer patients. And God forbid, they will not wipe a patient up if they need that. Well, you know what? I'm not speaking for all nurses, because again, there's always bound to be exceptions. But one thing I can tell the aides is that you can do your job, which is basic nursing skills, basic direct care, which is non-invasive. The nurse, on the other hand, has to interface with so many people. She can do your work, that is true, but you can't do hers. So when you see a nurse sit down and she's looking at the computer or she's talking on the phone, that is when she's not idle. She's doing something, because I hear that from aides all the time. The nurse just sits there and she doesn't help with anything. It could just be that 5 minutes she's sitting down is the time she's able to just catch her breath. A lot of nurses go without bathroom breaks, because when they're busy calling the doctor, they're interfacing with the pharmacist or the labs or even family members. What are you doing? This question is for the aides. What are you doing? Yeah, you could tell me, well, yes, I'm changing my residents, I'm feeding them, I'm ambulating them, and that's fine. That's all part of your duties. But I can tell you, you have more downtime than the nurse. And I've had some CNAs come back to me now and say, oh my God, I have a totally different perspective on nurses, because they have gone through nursing school and they have become nurses. And I can tell you, I can totally promise you, nurses don't have it easy. There is no time to rest. Most nurses do not get a break. They cannot catch a break. So when you as the aide, you're dumping on them and you're feeling really, like you're feeling overwhelmed, just know the nurse is too. A good nurse paces herself. I pace myself, because if I don't do so, I've shared with you guys the excruciating pain. I have sciatica and low back pain. It kills me. I have to pace myself. So the little time I'm sitting on my desk, just again, maybe I just have my eyes closed. I'm yet to see me even doing that, because I am not able to. Believe me, that is just that 5 minutes, because after that, the doctor, I'm following up, I'm charting, I'm doing wound care, I'm doing breathing treatment, I'm hanging up IVs, I'm giving intramuscular shots or injections, giving medication through different routes or routes. So there's so many things. You've got to pace yourself. I'm feeding patients either through the G tube or their nasogastric tube. There are myriad of things. Or I'm drawing blood. These are all the things that are invasive, and they are skilled that you, the nursing aide, cannot do. Now, having said that, nurses also should try as much as possible. If there's a downtime and this aide is actually crying out for help, you should be able to help. If you can, you should. The aides are no less than you. I've always said this anyway. But, so those are the differences. What also are the differences? I would say, like when you say Santa's little helper, the aides are Santa's little helper. Does that make sense? You cover things that the nurse cannot do. You are the legs and the hands and the eyes of the nurses. Really, you are. If you look at my video, I'm going to put one up here, because I talk about these things all the time. That the aide is the bedrock of the healthcare industry. They are. You're the first point of contact and the last point of contact. And that is the truth. So you are the nurse's little helper. Okay, and that is not to belittle what you do, but again, you're their eyes, you're their ears, you're their hands, you're their legs. You see things that when you report to a nurse, the nurse knows then to make an assessment and to use the direct channels in getting care back to that patient. So what else? Let me see. Am I missing anything? If there's anything I'm missing, again, go ahead and comment it on the comments below. If you're getting any kind of value from me today, if I've given you any kind of clarity, then please go ahead, smash that like button, smash the notification bell, and of course smash the subscribe button. I appreciate you and things like this, because again, just doing this, it's all to make us all, we are a team. We really are. People need to understand that. Nurses cannot work by themselves, and aides really cannot work by themselves, because, there are things that nurses do and there are things that USD aid does. We all should respect each other. So again, you know what? If you want to know more about nurses and aides, go ahead and check out my videos, that I put up. Again, I also teach skills. So skills that will help you, technique that will help you to pass your state exam. So I'll see you on the next video.